You're listening to Health Matters with Karen Key, getting you one step closer to a clean bill of health.
And a very good evening to you from tonight's edition of Health Matters. This evening, I'm joined by Dr. Johann Bruckner. He's a registered and qualified general surgeon with a special interest in minimally invasive surgery in the management of venous disorders, including varicose veins, spider veins, venous ulcers, and chronic venous insufficiencies. And this evening, we'll also be telling you about advanced endovenous vascular surgery for varicose veins. Johann, good evening. Welcome back to the show. It's been a while since we chatted. I thought it was a good time just to remind all our listeners about what we can do about unsightly varicose veins and all sorts of other veins and venous issues that we have. So I'm looking forward to chatting with you, and I'm sure the listeners are as well. And just a reminder, if you need any information regarding health matters or something you hear on the show, you can email me on healthmatters@safm.co.za. And like I always tell you when I do a phone in, if you have any questions, please do call as soon as you can, because as we always seem to have happen, is that towards the end of the show we end up with a whole pile of calls and we can't get through them all. So if you have any questions, please call as soon as you can on 0892 10 2010, 0892 10 2010. Tonight we're talking about your veins. As the heart beats, it pumps blood through a system of blood vessels called the circulatory system. The vessels are flexible, hollow tubes that carry blood to every part of the body. Arteries carry oxygen-rich blood away from the heart, and veins return oxygen-poor blood back to the heart. Veins are flexible, hollow tubes with flaps inside called valves, and when your muscles contract, the valves open and allow blood to move through the veins. When your muscles relax, the valves close, keeping blood flowing in one direction through the veins. Now, veins become larger and larger as they get closer to the heart. The superior vena cava is the large vein that brings blood from the head and the arms to the heart, and the inferior vena cava brings blood from the abdomen and legs into the heart. And if the valves inside your veins become damaged as a result of venous disease, the valves may not close properly, allowing blood to leak backwards or flow in both directions. So what are venous diseases? Well, they include blood clots, deep vein thrombosis, superficial venous thrombosis or phlebitis, chronic venous insufficiency, varicose and spider veins, and ulcers. Well, now that we've got all that out of the way, let's find out more from Dr. Johann Bruckner. So, Johann, veins, it's one of those things we all have, obviously, but some of us have more problems with them than others. So what exactly are these varicose veins that we talk about?
Or dilate or enlarge to accommodate the extra pressure, because now there's blood sitting within that vein that's not finding its way back up towards your heart, and that vein then abnormally enlarges or dilates, and it ends up as a varicose vein. And those varicose veins can then have a variety of different types of symptoms.
Like what?
So the most common thing that we see is a condition called chronic venous insufficiency. So chronic venous insufficiency is when you have this condition where your veins are insufficient, so they're not draining the blood back up to your heart. And varicose veins is one of those symptoms. Now, varicose veins in itself, in our women patients, for instance, become painful around your menstrual period on a monthly basis. They also become very painful and itchy in very warm weather, where these veins tend to dilate and become even bigger in warmer weather. This is an interesting thing, that in the winter months we actually see very few vein patients come to our clinics, because the veins shrink down because it's so cold, and patients wear longer clothes to cover the veins, so it's blissfully sort of out of sight, out of mind. So veins tend to do worse in warm weather and better in colder weather. Then, again, in terms of chronic venous insufficiency, the second thing that we see are spider veins. So spider veins are those very thin, thready type of veins. They appear as a bruise on the skin, and they are usually defined as patches, whereas varicose veins are those thick, tortuous veins, larger than 3 to 5 millimeters, and they run down the legs, very obvious, very disfiguring in appearance. And then the third aspect of chronic venous insufficiency is the symptoms that we find due to the condition, and that includes things like restless legs at night, heavy legs, and those legs usually become heavy towards the end of the day. So those patients wake up first thing in the morning and their legs feel fine. As the day drags on and they spend a lot of time on their feet, their legs get heavier and heavier.
Now, I know people don't like the look of these veins sometimes, and you said it can be quite painful and itchy and all sorts of other things, but can it be a problem? I mean, should it be something we should be very concerned about, or is it just really a cosmetic thing at this point?
Yeah, so spider veins are usually just a cosmetic problem. So it's a cosmetic disaster if you want to wear something short, and we treat it from a cosmetic perspective, but it doesn't have any medical adverse outcomes. It's very different with varicose veins. A varicose veins is usually a sign that there is serious chronic venous insufficiency that's causing the varicose veins. And chronic venous insufficiency or varicose veins can be classified according to a system, we grade it from stage 0 to 6. Now, when you get to stage 3 and 4, it becomes mandatory to treat those veins. As you progress down that grading scale, you end up with skin conditions and then eventual ulceration. So not everyone will end up with an ulcer, but 5 to 20% of patients with chronic venous insufficiency can end up with an ulcer, which is an open wound that we find in the skin. But lesser than that, patients develop skin conditions like venous eczema, which is a type of eczema. It's a very itchy type of skin condition, and it's usually quite resistant to normal treatment unless you treat the vein that's causing the venous eczema.
Now, I know we've spoken when you were here with us before, we speak about removing these veins, but is that pretty much all we need to do, or is there further medical treatment needed as well?
Yeah, so I think if we look at the history of how veins have been treated in the past, in 1906, the vein stripping surgery was first described, and that basically entailed making an incision up in the groin, threading a cable down the vein, and then tearing the entire vein out.
That sounds awfully painful.
Yes, horrible surgery. There's not a lot in terms of surgery that we do in the human body where we tear flesh out of a patient. So, yeah, I'm not a proponent of that surgery.
No.
So that was the only surgery, the only option that we've had in patients, but it had very unsatisfactory outcomes. In fact, our studies have shown that in 60% of cases, those veins return. So you have recurrent varicose veins. Apart from that, prior to the advent of modern vein surgery was compression stockings. So a compression stocking is graded from a very low grade of pressure to a very high grade of pressure, and you wear those stockings during the day. So you put them on in the morning when you wake up, you wear them the entire day, and you take them off at night when you go to bed. And those stockings would collapse the veins. They would essentially act as an external valve to the vein and allow blood just to drain up towards the heart.
And now we have this something called advanced endovenous vascular surgery. Is that a lot less painful, not sounding quite so almost prehistoric when you're doing the surgery?
Yes, absolutely. So fortunately, about 10 years ago, the whole world of veins was turned upside down. We developed a completely new understanding as to how varicose veins form, where they form from, and how we should be treating them. So these days, varicose vein surgery is done under ultrasound guidance. So we use an ultrasound machine to examine your legs to determine exactly where the problem areas are. And then when we proceed to surgery, all of this is done basically through a keyhole or a very, very small incision, usually 2 to 3 millimeters in size. It's usually just large enough to allow us to pass a very thin wire up the vein to the particular area that needs to be treated. And then we do this under local anesthetic. So we inject local anesthetic along the vein while the catheter is in there, and then we activate the catheter and we burn and ablate the vein. So it basically gets cauterized.
So you have a better outcome, and hopefully you don't have a recurrence of the vein issue.
Absolutely. So our studies have shown that these patients have a far lesser chance of developing recurrent veins. And the procedure is in fact so comfortable that we don't need to do it in a major theatre anymore. These procedures are done in the office under local anesthetic. So it means the patient walks in and they walk out 30 minutes later with a bandage on their leg.
Gosh, that's so much better than an anesthetic or the whole hospital admission, and I'm sure it makes the whole procedure a lot more cost effective as well.
It does indeed. The medical aids do love us because it cuts about 50% of the cost of the procedure, having it done in the rooms as opposed to having it done in a major theatre. So these intravenous ablation procedures, as I've just described, can be done with a radiofrequency catheter. That's the type of technology that I prefer using. But it can also be done with a laser catheter. So there are very slight differences between the two techniques, but they essentially come down to the same thing, that we're applying heat to the vein. And then beyond that, the latest development that we've been using over the past year is to glue the vein.
Glue the vein?
Indeed. So there was a very intelligent radiologist from the States that realized that the glue that he's been using in aneurysms in the brain might as well be used to glue varicose veins in the leg. So they started trials and eventually have proven this, and the product has come to market. So the technique is very similar to the endovenous ablation in that we insert a very small catheter up your leg. But then instead of having to inject a local anesthetic and then applying heat to the vein, we simply inject superglue, a medical grade type of superglue, into the vein, and we glue the vein together.
And that stops this varicose vein developing? I mean, or getting worse, or what, does it just reduce the thing? What happens to it?
Yeah, correct. So again, just in terms of explaining it, the varicose veins that you see on the surface of your skin, those are a symptom. The vein that's causing them lies deeper within the tissues. So that's a vein that we need to treat. So that's the one that used to be stripped out and that we now can treat with an endovenous catheter, and that we now can actually glue shut. Once that vein is closed, it relieves the pressure on that cluster of varicose veins. We still have to deal with that cluster of varicose veins. My preferred method is to inject it with a sclerosant. So a sclerosant is a type of chemical. When we inject it into a vein, it strips out the inner lining of the vein collapses, it becomes solid, and then your body will naturally absorb it, and it disappears over a period of 3 to 6 months.
Well, this whole thing, I mean, now we're gluing things together. I mean, Johann, this sounds almost like something out of science fiction here. You know, I mean, it's not pumping ourselves full of super glue. But I mean, it's wonderful to know that all these amazing things are now stopping us from having to go through this ripping out or whatever you're doing with it. We used to be able to have to do with those varicose veins. It's a little bit less traumatic, I think, now, all this new stuff.
Yes, it's actually a far less traumatic and invasive method of dealing with the veins. And this is where surgery and medicine as a whole is moving towards. We're moving away from major open surgeries to very minor, least invasive type surgeries. Yeah, so you're quite right in that we are achieving better results in a far less invasive way. I always use the example in telling patients that if you were to cut your finger or sustain quite a significant cut on your skin, your body reacts to that by releasing a hormone that allows new blood vessels to grow in that area. Those new blood vessels allow for oxygen and nutrients to go to the wound, and the wound will heal up. When you go and you tear a vein or strip a vein out of the middle of your leg, exactly the same response follows, and your body grows a whole bunch of new blood vessels. And this is why that old surgery was so ineffective, because you would get that response. With the new surgeries, it's almost atraumatic, so there's no trauma to the tissues, and you end up with none of that new blood vessel growth.
It sounds really great. If you have any questions, please give us a call, 0892 10 2010, 0892 10 2010. The development of these varicose veins, I know a lot of women during pregnancy, it seems to be the perfect time for these things to suddenly appear. And then are you stuck with them after that? What happens? Or do they automatically, once the pregnancy is over, do they just sort themselves out? What happens?
Yeah. So the major reason for you to develop varicose veins is usually your family history. If you have a parent with varicose veins, there's a good chance of you developing varicose veins. If you have both parents with varicose veins, there is an excellent chance, unfortunately, that you would end up with varicose veins. Now, when you have a genetic predisposition for it, you're basically born with normal valves, but poor quality valves within your veins. And then in our female patients, as soon as they go through pregnancy is quite a significant stressor on the valves and the veins. And those valves then tear open and they don't recover afterwards. So during pregnancy, your veins will dilate or open up to accommodate the extra blood volume that you carry, which is about 2 to 3 liters. So those valves do open up and they become incompetent temporarily. But in patients with vein disease, that valve will then tear permanently. So in most patients, that vein after pregnancy will go back to normal and the varicose vein will disappear. So you do find patients where the pregnancy actually is the event that tears the valve, but in the majority of patients, their veins will go back to normal. That's why during pregnancy, we advise patients to wear stockings. So we obviously don't do these procedures during pregnancies, regardless of how severe the veins are. Those patients would have to wear stockings, and then in the patients where the varicose veins persist beyond pregnancy, we would do a procedure afterwards.
Is there anything we can do to prevent this from happening?
Unfortunately not. If you are a woman that's going to go through pregnancy, if you're planning a pregnancy and you have a strong family history of varicose veins, it's probably a good idea to get in and see a vein specialist and have an ultrasound done on your legs. So if there is a problem with reflux, then we can attend to that prior to your pregnancy. In the olden days, when the outcomes from that surgery was so poor, the advice generally was to patients to have all your babies and then have surgery at the end. And that's changed now. Once we identify a reflux problem, so if we find that there's a broken valve in one of the veins, then we go ahead and we treat it. We don't wait for you to go through different pregnancies.
Oh, that's good to hear. And the other thing as well, as part of this whole venous insufficiency thing, is something called phlebitis. And I think a lot of people know what that is because they all have it. Can you just explain, for those who don't, could you explain what phlebitis is all about?
Yes, so phlebitis is a painful condition. So those varicose vein clusters that you have on your leg, they can from time to time form little clots. Now, these are not dangerous clots. It's not the type of blood clot that will pass to your lungs or to your heart. They get stuck in the soft tissues. Now, when blood clots, it creates a significant inflammatory reaction. And that severe inflammation causes severe pain in that particular area. And then phlebitis is the actual inflammation of the vein itself. So,
and that is treatable?
Yes, it's generally treated with cold compressors, hot compressors, anti-inflammatories, rest, elevation of the limb, all those normal sort of things that we do to treat inflammation. And it usually will settle down within a week to 10 days.
Well, that's not too bad, but I'm sure going through that pain can't be great at all. And we mentioned earlier about spider veins. Is there anything we can do about those? And also, you know, when some people have those very fine veins on their face, they get them around their nose and on their face. Are those also spider veins? And is there anything we can do about those?
Yeah, so spider veins most definitely can be treated. Worldwide, the gold standard treatment is sclerotherapy. So sclerotherapy is the injection of a chemical into those veins, and what it does is it strips out the inner lining of the vein. That vein becomes solid and your body removes it naturally. So all the spider veins below the level of your heart, so that's in some patients on the abdomen and in most patients on the legs, we do sclerotherapy. And it's usually a couple of sessions, about half an hour session. We inject these little veins. We identify the feeding veins that feeds a particular patch of spider veins. It gets injected and you need to wear compression stockings afterwards. On those veins, the veins in the face, so generally everything above the level of your heart, so in the décolletage, the neck area, and then on the face, we recommend you seeing a dermatologist because those treatments are more successful if you use lasers and lights.
Oh, really?
IPL.
Oh, so a laser would actually work on those on the face and, as you say, above the heart. Why is there this difference between the two?
So sclerotherapy is not a safe medication to inject into the face. So I have not come across any vein clinic in the world that would offer that service. It's just safer to use a laser or a light. And then in the legs, lasers and lights are not that effective. We've seen that in that those patients just simply fail treatment. Sclerotherapy is the indicated treatment in the legs. And it's purely on where you're going to get the best effect.
Now, over the last number of years, because we'd never really heard about it up until about, say, 10, 15 years ago, where suddenly if you were flying, you had to be very concerned about deep vein thrombosis. Can we just talk a little bit about should we be nervous about this? What is it? How can we prevent it possibly from happening? What do we do?
Yeah, so the entire discussion that we've had up till now has dealt with the superficial veins. So when we say superficial veins, we mean veins that sit outside of the muscles within your legs. So all the veins that are within the muscle, so generally within the leg muscles and next to the bone, those are deep veins, and you have very few of them. When you develop a clot within the deep vein, it's known as a deep vein thrombosis. Now, those clots are far more dangerous than superficial vein clots, where a superficial vein would cause pain and inflammation in a very localized area. A deep vein thrombosis, that blood clot will essentially grow in inverted commas. So it might start in your calf and it'll progress up towards your thigh, and from your thigh it can progress into those very large blood vessels into the lower abdomen. Now, as it does this, there is blood flow that goes up to your heart. So if pieces of that blood clot breaks off, it'll pass into your heart, and then from your heart it'll pass into your lungs. When that happens, it's known as a pulmonary embolism. So studies have shown that a lot of DVT patients, by the time they present to hospital, they actually already have subclinical, meaning we can't pick it up on clinical grounds, they already have a subclinical pulmonary embolism. So those are very dangerous conditions, and they need prompt medical attention. And essentially it comes down to blood thinning treatment, and that blood thinning treatment is then carried on over several months.
So as I mentioned about this flying thing, so should we be doing something before we fly? Because there was always this talk about, move your legs around, get up, sit down, jiggle your feet, do whatever. Should we be panicking when we fly, or are certain people more susceptible to this than others?
Yeah, so I don't think we generally need to panic about it. The basic things that you need to do when you fly is you need to move around. So I always tell my patients, try and book an aisle seat and drink plenty of water, because that solves a whole bunch of different problems. If you drink a lot of water, you'll be well hydrated. So blood clots don't really form in a well hydrated patient. It's more likely to form in a dehydrated patient. So that's why you don't want to drink too much alcohol, because alcohol will slightly dehydrate you. And also, when you're drinking a lot of water, you're going to get up and go to the loo a lot, so you're mobilizing and you're moving your legs. So an aisle seat, lots of water, and you should be okay. There are patients, specific patients. So these are generally our very elderly patients who are not very mobile under usual circumstances, and then very obese patients, pregnant patients, patients taking extra exogenous hormones like hormone replacement therapy, and then patients with blood clotting disorders. And unfortunately, a lot of those patients, they don't know that they have a blood clotting disorder. It only comes out when they have their first blood clot. If you have multiple blood relatives who've had blood clots in the past, you need to be checked, because you might have an undiagnosed blood clotting disorder. So those special groups of patients, yes, they need to take extra care. And it's best in those cases for them to consult their GP before they go on a long flight. So anything more than 4 hours essentially is considered a long flight.
So now we land, and we thought we were doing okay, but now we land and we're now not feeling too good. What sort of symptoms should we be looking out for to make quite sure we get to the hospital in time in case there is a problem with this DVT?
Yeah, so I think if you've been on a long-haul flight, so anything more than 4 hours, you land, and sort of within the first day or 2 or 3 days, you start developing pain in your leg and swelling. So pain in the calf, and your calf feels stiff and sore, like you've pulled a muscle. It might even be swollen a little bit. You can put your 2 hands with your thumbs and your middle fingers touching, and sort of just get a gauge as to what the size of your calf is compared to the other calf. If it's enlarged and you have a sore, stiff, swollen calf muscle, you need to go to a hospital to get a DVT scan. It's as simple as that. So if your leg feels stiff and sore and it feels like you pulled a muscle, and you know that it's not possible that you could have pulled a muscle, you might have a DVT.
Okay, so we can now hopefully fly in peace and know what to look out for once we get to the other side.
Absolutely.
Okay, so there is something that can be done about it.
Yeah, so when you go to the hospital, then, there's 2 things. There's a blood test that can be done that's not that accurate. The most accurate assessment is if someone examines your calf and they do a duplex ultrasound. That'll tell without a doubt whether there's a blood clot or not.
Okay, so maybe we should just tell the doctor we've been on this long-haul flight and possibly this could be a deep vein thrombosis. Could you please check for it?
Absolutely. That's vitally important to say that to the doctor that's examining you.
Yeah, don't just say, well, my leg's feeling a bit sore.
Yes.
Could you have a look at it? Mention the part about having been on a flight, because that's I think the giveaway clue. Possibly. Absolutely. For what they're going to look for. Well, you're listening to Health Matters on SAFM. I'm Karen Key, and this evening we're focusing on your veins with Dr. Johann Bruckner. If you have any questions, 0892 10 20 10, and we're going to be taking calls in a moment. So if you want to get your question in, give us a call now before it gets to the end of the show. Right, so Johann, with all these veins and all these things, the thing I think that people concern themselves most with is there something we can do? And we've pretty much told them it isn't something that nothing can be done about. So every vein that's an issue for you, you just need to go and speak to somebody that can assist you. There is treatment available. Yeah,
very much so. Don't just sort of accept the fact that you have these veins and nothing can be done, because there's nothing further from the truth. Go find a vein expert, have your leg scanned. That's the simple advice. If you go through the process and you end up with a surgeon and the surgeon's offering to do a stripping surgery on you, I would strongly suggest that you get another opinion.
Because that's sort of outdated treatment now.
Absolutely.
Doesn't work like that anymore.
Absolutely, yes.
Right, okay, let's take our first call. Peter in Durban, good evening.
Good evening, Corin, and to your guest. Just anecdotally, many years ago we had a neighbor who persistently suffered from very close veins instead of varicose veins. I think she's probably been enlightened by now. But my question comes to asking about two things. One is the spider veins, which has been answered already. And the other one is, earlier on you mentioned that you've got a heavy leg syndrome where your legs get heavy after standing on during the day and that. But what happens when you've got that feeling in the morning where you've actually got to literally wiggle your toes and move your feet and everything to get ostensibly the blood flowing? What would be the cause of that?
Johann, heavy legs in the morning?
Yeah, so generally in a vein patient, their legs recover during the night. So it's because of gravity during the day that you develop the heavy leg, because it's a swelling that takes place in the legs. It's literally fluid leaking out of the veins and it sits in the tissues. So you develop swelling and you develop a heavy leg towards the end of the day. And when you sleep at night and you're in a horizontal position, that fluid has an opportunity to then drain back to your heart and that heaviness is relieved. So when you wake up in the morning, the leg feels a lot better and then it starts building up during the day again. If you wake up with a heavy leg, it could be that you do have quite severe venous reflux, that you're not that active, and that that the swelling in the leg is actually not improved during the night because you have quite severe reflux. That's one of the explanations. The other is that you could have a rheumatological condition, so it's not your veins, but rather a joint and soft tissue issue, especially if you say that you have to wiggle your toes to sort of get them going, like in rheumatoid arthritis. Those patients wake up and they sort of take a half an hour before all the joints and things loosen up, and then they can get going. So there are different explanations for it.
So essentially what it's called is probably old age catching up.
No, it could never be that, Peter. Never.
Yeah, we didn't say that.
No, all right. But thank you very much. Just a point on that is, by taking a diuretic, which I'm taking obviously for other reasons, it seems to relieve, because my feet swell and contract as these things kick in, and I avoid a lot of the fluid. Then my feet are thin.
Yes.
But there are times when they will actually swell up a bit, and they feel they've got like a dull feeling in them. Is that?
Yeah, correct. So you have edema, so you have swelling in your feet. It's probably not venous in origin. It could be cardiogenic, coming from your heart or coming from your kidneys. So your body's just not dealing very well with your fluid balance, meaning it's retaining too much fluid and not getting rid of it through your kidneys as normal. And that fluid will end up in the most dependent or the lowest area in your body, which is around your ankles and your feet. And during the night, your kidneys are not catching up and excreting that fluid. So if you are already using a diuretic, it's either a blood pressure issue or something with your kidneys. Did your GP or somebody prescribe the diuretic for you?
Yes. I'm on blood pressure tablets, and coupled with the diuretic, and also because of some I don't know, erratic heartbeat. You've got these
yes, atrial fibrillation most likely.
pacing tablets. Yeah, you take a half of one and it sort of...
And some of those tablets as well can contribute to swelling in your feet and your ankles as well. So unfortunately, using it to treat the one thing and it's causing another problem in a different area.
So you see, Peter, it's not the old age, Peter, it's the medication.
Well, we're supposed to move a little bit faster now, right?
Start taking up jogging or something. It sounds like that's what definitely
so
called
much,
for. Pleasure, thanks for the call. Good night to you. Bye-bye now.
Bye.
Right, we're off to Polokwane next. Gerald, good evening.
How are you?
Hello, very well. How are you, Gerald? How can we help you?
I'm very well. I just want to ask a question to the doctor.
Okay, go ahead, Gerald.
No, I just wanted to know, like, doctor spoke with many procedures that can help, like, for instance, surgery. Can help to reverse the condition with that? Or, like, for instance, and my second question, with the physiotherapy, because they say physiotherapy can assist with exercise to vasodilate the veins, so to increase blood flow. So I just wanted to find out with the doctor, can really help to assist with the varicose.
Okay, so Gerald, you were asking whether surgery was your only option, or were you asking whether physiotherapy could help with that as well?
Yeah, both surgery and physiotherapy.
Okay, so for varicose, so how bad are they, Gerald?
Sorry?
How bad?
It's someone that, like, I've seen, it's really bad. During the day, you can see even, like, the veins out.
Yes.
Like, yeah, on the legs, yes.
Okay, Johann, surgery, physiotherapy, any suggestions here?
Yeah, no, there's no question about it. It's surgery or treatment with a compression stocking. Unfortunately, physiotherapy is not going to do too much to your varicose veins. We obviously encourage patients with varicose veins to be as active as possible. So we don't want you to sit down behind a desk for extended periods of time, and we don't want you to stand in one position for extended periods of time. Sometimes, due to your job requirements, this is not possible, and you're basically stuck in that situation. But if it's possible, you need to be walking sort of intermittently every 5 minutes or every few minutes. Get up, walk around a little bit. Don't be in a static position for too long. That is really bad for your veins. If you can't escape that, then it's best that you wear a compression stocking during the day. And if you're looking for a long-term solution to it, you need to be looking at surgery.
Your physiotherapy is not really going to be the thing to help you here.
No, it's not. But it might be that Gerald might be referring to a different condition where you have arterial insufficiency, where there isn't enough blood flow into the leg, as opposed to a problem that we've discussing with the veins.
Yeah, because he mentioned the increasing of the blood flow. So maybe that is Gerald. Is that what it is?
Yes, isn't like when you do exercise, the blood flow increases. So, like, I was basing my questions on that aspect.
Yeah, so that's apparently you're doing the right thing if you're doing exercise then, because you're moving, and that's what you need to do.
Yes. So what about, because physios normally they offer therapeutic massage, it was mentioned that it can actually increase blood flow. Can it help also?
With therapeutic massage?
Okay,
yes.
So then there's a third condition that we could be talking about as well, called lymph edema. So lymph edema is it that you suffer from lymph edema?
It's a buildup of fluid in your limbs.
Correct.
Gerald?
So it's a lymphatic condition where there's lymphatic fluid that builds up. So your legs or your ankles tend to look square towards the bottom. It doesn't taper down like in a normal person. And when you squeeze on your leg, it doesn't leave an indentation where you put your finger down. In normal swollen limbs, if you push with your finger on one spot and you keep pushing down, it'll leave an indentation in the skin. So that's normal pitting edema. And that means it's a fluid overload condition. But lymph edema, the leg will look swollen, but when you push your one finger, it'll not make that indentation. So in those cases, yes, physiotherapy is the number one treatment.
And the therapeutic massage as well, probably, yes.
Correct.
Is it helping, Gerald? Are you going for all of those things?
It's helping. No, I was just asking on behalf of someone so that one day I can assist, with an opinion from the specialist.
Okay, it just depends on what the condition is, though, Gerald, because all those different things you've been telling us could be one of three different things.
Yes, I did understand.
Okay, so all these things, if those are the conditions, they will help.
Sorry?
If those are the conditions that the doctor mentioned, then that would help the person you're asking for.
Yes. No, I did understand.
Great. Well, thank you so much for the call.
Oh, thanks a lot, Colin.
Thanks, Gerald. Have a good evening.
Thank you.
Thanks. Good night to you. You're listening to Health Matters on SAFM. I'm Karen Key, and this evening we're talking about your veins with Dr. Johann Bruckner. If you have any calls or questions, 0892 10 2010.
You're listening to Health Matters with Karen Key, getting you one step closer to a clean bill of health.
Right, and we'll continue with the calls. John in Gauteng, good evening.
Yes, good evening. How are you?
Hello, very well, thank you, and you?
Thanks for taking my call.
It's a pleasure. How can we help you, John?
I'm more interested in eczema. I just want to ask your guest today if there's a relationship between, or basically, let me rather rephrase and say what causes eczema, and if in the treatment of eczema one happens to use cortisone, can the side effects be fatal? And if there's a relationship between eczema and chickenpox.
John, we're not actually talking about eczema. We mentioned eczema, but only as far as it relates to veins and varicose veins and spider veins and all those sorts of things. Johann, I don't think this is really your field, is it? Or
yeah, no, best answered by a dermatologist.
Yes.
So the only eczema that we deal with is venous eczema. So if you have a type of eczema, which is a skin condition where the skin is red and inflamed, it's sometimes flaking, it's very itchy, and it occurs predominantly on your lower leg and on the inside part of the lower leg. Those cases are generally venous eczema cases, and when we examine and scan those patients, we generally find veins that would cause that particular area of eczema. So it's not a generalized body condition. We have eczema all over your body. It's in a very specific area on the lower leg, on the inside of the leg.
So, John, unfortunately, it's not something we are talking about general eczema this evening. And if you need some more information, I suggest that you contact your dermatologist, or if you go to the clinic, I'm sure there is a dermatologist on staff there, and they'll be able to help you. So, you know, unfortunately, the eczema we were talking about is specifically related to conditions surrounding veins. It's not the general normal eczema that we normally talk about. So yes, I think you go and speak to your dermatologist, and that would be your best bet. Okay.
Thank you, but I'm saying this. Hear me out. I have those symptoms on myself.
What, the varicose veins?
Yes.
And you have the eczema on those veins. Is it around that area?
Yes.
So you mentioned using a cortisone and the side effects of the cortisone. If you have venous eczema, it's best that you examine by somebody that deals with veins and have a look and see whether there's venous insufficiency. If that's the case, then ideally that needs to be treated. So the long-term use of corticosteroids, the topical corticosteroids, they have their side effects, and there's a whole long list of it, and a dermatologist can give you more information about that. But it's not advisable to use that over a long term, especially if the course of the eczema is a treatable one. So then obviously you want to treat the cause, and then you would be able to stop using your topical steroids.
Also, the other question John asked a little earlier was whether it could be fatal. I don't think using a cortisone cream is necessarily fatal, John.
Yeah, no, there are very high potency topical steroids that can cause suppression of the adrenal glands, but now we're getting into rarities.
Not the normal run-of-the-mill stuff. So John, I think you need to go and speak to a specialist about this, and they would be able to help you. The thing is, if it is related to the veins, it is something that is treatable, and hopefully you won't have to continue using the topical cortisone treatment.
And who will that kind of specialist be, if I may ask, your guest?
So you need to see a vein expert. So in Gauteng, you're welcome to come and see me. My contact details is at veinsurgery.co.za. Or the best thing would be to go to your GP and ask your GP to have a look at your legs and then make an appropriate referral.
I will be giving out all the contact details for the vein centres at the end of the program. So if you want to all get your pens and paper out, I will give all those details later, and you can contact Dr. Bruckner's clinics around the country. Okay.
Thank you very much.
Thank you, John. Have a good evening. Right, off to Durban now. Rena, good evening. Hello.
Good evening, Doctor.
Hi, Rena.
I phoning on behalf of my husband. He's got varicose veins on his legs. Now, about a year ago, he developed an ulcer on his leg, and it's just not healing.
Okay, yeah, Rena, thanks so much for your call. That's a topic that I really wanted to discuss as well. So, vein ulcers occur around 5% of cases in patients that have chronic venous insufficiency. And the reason why that ulcer is developed is that very close to the ulcer, there's a short circuit of blood between two vein systems, and it's causing a massive increase of pressure within the veins in that particular area. And then the blood that's causing this increase in pressure is devoid of oxygen and nutrients. So that area of the skin is being bathed in old blood continuously, so the fresh blood has a great amount of difficulty getting to that particular area, and the skin then suffers. So you would have developed a small little ulcer, and then it progresses and it becomes a bigger ulcer, and there's literally not any building blocks to repair the tissue. So the only way to repair this is to find that faulty vein, close it, and then the body would be able to heal that ulcer. So in terms of your husband, he needs to be examined. So we need to have a look at his leg, see where that faulty vein is, and see which way would be the best way to treat it, to close it. Once that vein is closed, on average with venous ulcers, they take about 3 months to heal, and then we don't really see recurrence. In some cases an ulcer can come back, but the treatment is usually minor to get rid of the second ulcer.
Okay, but you see, he's a stroke patient and has had 2 heart attacks, so they're a bit not comfortable to do any kind of surgery because of the high risk. And he is being seen by a vascular surgeon. But I must say, slowly, very slowly, it's becoming smaller, but very slowly. It's gone over a year now. So I don't know if there's any other treatment other than what you've mentioned.
Yeah, well, if you want to treat it conservatively, then he needs to be doing lots of walking, and he needs to wear Class 2 compression stocking. So incidentally, the procedures that we do, because it's minimally invasive, actually removes all the risk in having a normal surgery. So you don't have all the associated risks as compared to doing a surgery or a procedure in a major theatre under general anesthetic, as opposed to doing something under local anesthetic. But if you choose to go the conservative route, that's still an acceptable option. He needs to be put into a fitted Class 2 compression stocking, and he needs to be doing plenty of walking, and then elevate the leg at night. And slowly over time, that also will heal up. But because you haven't treated the cause, you still have that faulty vein that caused it in the first instance, the ulcer is extremely likely to return within a year.
Oh. What is this Class 2 compression bandage? There's something called Tensopress
is just a bandage. It doesn't have a rating. A Class 2 compression stocking is a stocking that somebody fits onto your leg, and it's sized to your leg, and it applies a predetermined amount of pressure to the leg.
Is that the one that's fits quite tightly?
Correct.
But it's been specially fitted for every individual leg. It's not sort of a general thing that's one size fits all. It's not one of those.
In fact, we did get that too, but he's so uncomfortable in it. It hurts him, so he finds it difficult to wear that. So we're trying this other one, Tenoplast, what do you call it? Anyway.
That's difficult. Are you elevating his leg at night, Rena?
Yes, he does that. Even when he's seated, he elevates it. So
unfortunately, he has to be compliant on some sort of treatment to get a result.
Yeah. Okay. Thank you, Doctor.
Thank you, Rena. Thanks a lot. Good night. Bye-bye now. Johann, if people want you to come to the vein centres, where in the country are they?
Yes, I have 2 practices. The one is in Umhlanga, and the other one is in Four Ways in Johannesburg.
Okay, nothing in Cape Town. What if I get a varicose vein? You're going to have to open an office down here.
I used to have an office down in Cape Town, but it's like traveling to a different country. It's so far away from us.
It's not really. If I happen to end up getting a varicose vein, I'm going to have to travel with it now, and that won't be good either.
There are a couple of very good surgeons down there that do these procedures, so if patients want their details, they're more than welcome.
Okay, do you have a number of people in Johannesburg or Durban want to come to the vein centre? Is there a number they can call? I will give out the website. It's veinsurgery.co.za. Go and have a look at that. But if they want to call the office, what do they do?
Yeah, so in Johannesburg, it's 011 511 0020.
Okay.
And then in Durban, it's 031 566 3960.
Okay, I will give out all those numbers again. So if you want to get your pen and paper ready, I will give those out shortly. Right, Godfrey, you driving. Good evening. I hope with a hands-free kit.
I am on a hands-free kit. Good evening, all.
So you're safe. Good, that's good. I just want to make quite sure you were safe. Okay, right. How can we help you, Godfrey?
I did even stop the car. I just want to inquire this with the doctor. I have varicose veins on my legs, both legs. Quite a number of them. And last September, I was admitted with pulmonary embolism, and they could not determine the source of the clot. Now, I was on treatment now for 9 months, and I'm off treatment for a month now from warfarin. I want to inquire from the doctor, would he suggest, under the condition that I have not been diagnosed with where the origin of the embolism is it wise to discontinue, or should I continue with the warfarin?
Yeah, it's not an easy question to answer. It depends on whether they did a blood clotting profile on you when you were first admitted. So one of the things to exclude is whether you have an underlying genetic clotting disorder. So sometimes one or more of the enzymes that are involved in the clotting cascade in your body is missing, or it's overactive or underactive, and that causes you to develop blood clots more easier. So if you have a family history of other relatives having blood clots, then it might be worthwhile at this stage, once you've stopped the warfarin, to have those blood tests done. If it was done and it was completely normal, they didn't find the DVT, then we generally say a treatment period of about 6 months, and then it can be stopped. If you were to suffer a second pulmonary embolism or DVT, you will be restarted on treatment, and that treatment will most likely be lifelong.
Okay.
Did the doctor tell you to stop the medication, Godfrey? I always get nervous when we decide to do that for ourselves. Did the doctor say it was okay?
No, the doctor asked me to stop it. I'm seeing him again in a week's time.
Okay. So you are under medical care. Okay.
Yes. He asked me to stop for a month and see him after that to see what is happening.
And you're feeling okay?
No, not 100. I've experienced some headaches since then.
Well, good thing you're going to be seeing him again soon.
Yes, absolutely.
Yes, I'm seeing him next week.
Yeah, I just suddenly thought because sometimes I know I'm always tempted to do it myself. We feel so much better when we think, we'll just stop taking the medication. It's the worst thing to do. So I have to always be very good about saying to myself, you have to finish the course. So I think we all have to tell ourselves that. Don't stop just because we're feeling better.
Absolutely, especially with something like warfarin.
Absolutely.
Please, as general advice, do not stop a blood thinner unless your physician specifically instructs you to do that.
That's why I just wanted to double check with Godfrey. Godfrey, I hope everything goes well with the doctor next week. Thank you very much for the call, and be safe on the road.
Thank you very much.
Thank you so much. Good night to you. Bye-bye. Right, our last call for the evening. Seth in Pretoria. Good evening.
Good evening. How are you?
Very well, and you, Seth? How can we help you?
Yeah, I just want to ask one question. If you urinate and the blood passes through your urinate, what is the causes?
Oh my goodness, we're not talking about that, unfortunately, tonight, Seth. We're talking about varicose veins and all the veins in your legs and all the veins around on your body. We're not really talking about blood in the urine tonight. You need to speak. You need to see a urologist, Seth, or your GP to get a referral to a urologist.
Okay, if you also got a feet swelling, when you sit a little bit longer, then you find out that your feet are swelling. What is the causes?
Yeah, Seth, just based on that symptom complex, yes, most definitely get in and see your GP. He needs to have a look at your kidneys.
Okay.
You must go soon, Seth. Don't leave it. Hey, go tomorrow.
Yeah, thank you.
And tell him all those things you told us now, but go soon. Don't leave it. All right?
Yeah, okay.
Okay, thank you very much.
Thank you, man.
Okay, good night to you. Bye-bye. That's the one thing, just if we have whatever symptoms, if it's the problems with our veins, if whatever it is, I'm sounding like a stuck record now. I always tell people, please go to see your doctor as soon as possible. Don't leave it, because the sooner you get there, the more likely chance there is of something actually being able to be done about it.
Absolutely, Karen, and and I'm going to be shot down for this, but please don't go on the internet and go and try and diagnose yourself.
No, I often talk about Dr. Google. He didn't get a good qualification. He's not that good.
The Google indexes results based on popularity. So if you type in a symptom complex, you might get the most rarest cause for that symptom, and it's just the way that Google classifies it. So there's value in a medical degree.
I've been on there, and I've literally had every condition under the sun, because you'll have a symptom
and
which could be
terminal.
Well, precisely. You can have one symptom, but it could be linked to sort of 10 really bad things.
Absolutely.
Which you don't have those, but I've got a bit of a wild imagination. So if ever I do look on there, I scare myself half to death.
Yeah, I think the right way of going about it is see a medical professional if you trust your doctor, get a proper diagnosis, and then go and inform yourself. So if your doctor has given you a diagnosis, then you can go and read up and empower yourself, and you can go and read all the ins and outs about that condition.
But the doctors actually went and got a medical degree. The computer didn't.
Indeed.
So go and do that. Right, so Johann, just in closing, we've literally got a minute. Veins and all those sorts of things, people shouldn't panic too much. There is something that can be done, and I think we all still live with the memories of Granny and all the aunties telling us that this varicose vein thing was the worst surgery they ever had. It doesn't work like that anymore. It's not that bad. It's a sort of in and out in the surgery now.
Absolutely. So it's a complete new understanding of how we diagnose and how we treat veins. It's become a minimally invasive procedure. We can do everything in the office. There's no need to go to a hospital anymore, and it's not a debilitating surgery anymore.
Because I think it was quite a long recovery afterwards as well. It wasn't
1 to 2 weeks.
And then now it's you walk in and you walk out.
Absolutely. Young people go back to work the same afternoon.
Oh, that's so much better. Lots more things are being done like that. Gosh, I'm so glad I live in the time of advanced medical information and treatments, because it's not that bad anymore to be sorted out with something that back in the day was quite horrendous. Well, my thanks once again this evening to Dr. Johann Bruckner. He's a registered and qualified general surgeon with a special interest in minimally invasive surgery in the management of venous disorders. Johann, good night, and thank you so much once again for joining us on the show. I really always enjoy chatting with you, and hopefully you'll join us again in the future.
Karen, thank you so much for having me.
If you want more information about all of this, you can have a look at the website. It's www.veinsurgery.co.za. The number in Durban, 031 566 3960. Johannesburg, 011 511 0020. And of course, if you've missed all of that, just email me, healthmatters@safm.co.za, and I'll forward all that information to you.